And we are now at the midpoint of the midpoint. So we're at the midpoint of day 2, which is now the midpoint of the 2022 Digital Health Summit. And again, this is really all about evidence and sharing perspectives to make sure that the folks who are here today can better understand what kind of evidence is being found around digital health adoption within different communities, different countries around the world, and how we can help improve that evidence generation effort through better studies, better methodologies, better tools and techniques within our actual evidence generation motives and operandi. So what we'd like to do is we'd like to take some questions from the audience. We have people from all around the world here today, and we've got folks from the upper echelons of government, academia, of corporate, of multilateral agency, family foundations. Just looking through the current attendees, we have folks who are sitting with not-for-profits that are focused on cancer care and creating digital twins. We have investors. And so what we'd like to do is either through the chat box or through LinkedIn or through the Q&A section of Zoom, pop a question in there. And if you want to focus it on an investor or you want to just ask myself, we're going to have we've got about 15 minutes until our next session. And we want to try out just a free form Q&A session as we get into the midpoint of day 2 and the midpoint of the 2022 summit, since you have been hearing a lot about diversity, equity, and inclusion. You've heard a lot about women's health tech today. And of course, you know about the, we've got the Women's Health Tech Initiative Challenge coming up that's now open today. Go to our website, hitlab.org, to hear more about that, et cetera. So the idea is really to make sure that we have an opportunity to answer any questions that you all may have about, again, this digital health reset and where is the digital health evidence today and where are we seeing? Because as you saw yesterday, during the first on-site digital health summit meeting in 3 years since 2019 in New York City, you saw it was packed. There were people coming in from all over the world, flying in to be a part of that. And not only hear directly from the source, but also network, not only during the summit, but afterwards at the cocktail hour, and understand where the evidence generation is occurring, how it's occurring, and what's working, what's not working, so that as we're seeing more and more digital health technologies developed, as we're seeing them become more and more widely used, that folks are buying the right ones, they're investing in the right ones, because remember that it is really important to remember that healthcare technology and the spending and the investing is a zero-sum game. So if a bad technology or a technology that doesn't have a good use case or doesn't have a good value creation emphasis and energy around it takes $1 million, $5 million, $50 million, or $500 million, or $5 billion, as we've seen in some cases, that money then is not going to be used for technology that can actually help patients and help physicians and help life science companies develop better medicines, et cetera. So we want to make sure that as a community, we're working together to better understand this and to share perspectives and share evidence to understand where the investments should go, where the spending should go. So with that, again, any questions that you have on LinkedIn or on the chat box here, we'd love to hear your thoughts and on the topics that we're covering, et cetera. We also want to talk about the June 2023 Digital Health Summit, which will be, again, on site at Columbia University, June 20th, 21st, and 22nd. We would love for you all to be there in person. And again, if you go to the HITLAB Summit site, you can sign up there. And again, it's invitation only. So again, we want to make sure that the folks that are like you, that are in the community and are focused, their primary focus and passion is around utilizing digital and ensuring that the digital technologies that we're using are the most optimized and the ones that are the most efficacious. And so again, I've got some questions coming in on LinkedIn, and if you want to connect on LinkedIn and throw questions over there, that's completely fine. And again, I think one of them that are coming in from Rachel is around reproductive rights and understanding which digital health technologies are most apt to help folks today in the United States who are facing this unprecedented, really incredible asymmetrical reduction in medical technology access for women in the United States, which is something in the history of medical technology, it's almost unheard of internationally, globally, to see a reduction in access to medical technology, whether it's molecules, whether it's devices, or whether it's digital health, or whether it's procedures. We just have never seen this before. And asymmetrical actions will result in asymmetrical responses, and we're seeing that as well. If you talk to an OB/GYN, they're going to tell you things that will make your mind numb about what's happening because of these constrictions on medical technology access. And so the idea here is that that's one of the things that we're focusing on in our studies. We're trying to find the best medical technologies that are out there. You heard from Curio today. You heard from other women's health tech companies yesterday, and there are a number of new technology companies in women's health. Then if you were at the HITLAB Summit yesterday, you may have run into Verbena, which is a women's health tech platform to help women not only have community, but also this connectivity and the content that they need in order to find out what they can do and where they can do it to help encourage and help provide them the women's health tech access that they need. So we are, as one of our top priorities, focusing on women's health tech so that the reproductive rights of women around the country and certainly around the world, we've been working on this now for over a dozen years, going back to some of our grants and some of our work with USAID and whatnot back in the 2008, 2009 period. We do have another question coming in and really focused on US-based female-founded health tech startups that are fundraising. And we do see that there is a lot of activity there. And it's important to understand that fundraising activity doesn't necessarily mean you have to go to traditional stakeholders. If you are a women's health tech startup, and if you are trying to find funding and you are in an angel round and you need, something in the neighborhood of 250 or 500 or $1 million, there are a lot of angels right now that are funding women's health tech companies, not only for finding good, scalable, and sustainable business models, but also for doing the right thing. And it's a nice ecosystem to be a part of along those lines. So again, there are a lot of traditional funding sources, angels, certified and credentialed investors that are out there. And there are also a lot of folks that are non-traditional that are funding this. And whether it's a physician who is passionate about women's health rights, or whether it's someone who has a deep interest in life sciences and healthcare, there are a lot of folks out there. So absolutely again, if you need help, email me or contact me on LinkedIn. Happy to help out and connect you with folks. Frankly, there's a lot of folks that you've seen within the HITLAB Women's Health Tech Wednesdays who are also funding these sorts of companies. So you have a tremendous community here alone that you can reach out to and be a part of that. If a women's health tech company, or you know of a women's health tech company that is in that angel round and who are trying to raise funds in that area. So please do feel free to reach out. This is of critical importance to us now more than ever. And so do not delay in that whatsoever, please. So just looking at other opportunities for collaboration, we have, again, as I mentioned, not only the HITLAB Summit, Summer Summit coming up at Columbia University, the Digital Health Week in 2023, June 20, June 21, June 22, that Tuesday, Wednesday, Thursday. We also run monthly symposia, and we'd love to hear from you. If you have a presentation or a recently published paper or a book, you know that we love to have our book reviews and book presentations from author talks. And so if you know of anything that you think we should be presenting through our channels, either through our seminars, our symposia, or our summits, again, link in, email, or certainly chat and let us know what we can do and how we should, who we should be talking to in those areas, because we want to make sure if you see some digital health technology that's growing rapidly, we want to know so that we can share it with our community and certainly with you all as soon as possible, so that the adoption rates can go from 5 to 7 years to 2 to 3 years of good technologies with really strong management teams that have an offer to either improve outcomes, or improve the cost factors and the affordability or the accessibility of medical technology, not just in North America, but around the world. And so we've got a lot of other questions coming in now from the LinkedIn channel. And we've got someone named Alice who's asking about the growth of digital health in 2023. She's looking at this as an investor and wants to know what are some of the key factors if we're in a recession that could affect digital health funding and digital health purchasing through 2023. Great question, Alice. In general, what we're seeing is a tremendous pullback from the digital health funding levels that we saw in 2021 and 2020, but they are much higher levels than we saw in 2019. So in fact, while it's not necessarily a drastic pullback, it is something obviously from an unprecedented level of funding that we had at that point in time. So what we are seeing as well is that a lot of organizations, private equity, venture capital, strategics who are not in healthcare, and they want to do something that is more recession proof, because in general, you can anticipate, you're reading, there's a general feeling in Wall Street and the financial markets in London and Paris and Tokyo that there is a feeling of a recession that is going to come our way one way or the other. And so we're seeing alternative funding now through SPACs and through non-healthcare traditional funds. So you're seeing a lot of funds come out of sectors that want healthcare because it's recession proof. So they're actually looking at healthcare in times that they normally wouldn't look at healthcare, which is great. I mean, we obviously want to see digital health funded in any way, shape, or form. And the idea is that a lot of those investors now are trying to find new ways to place their funds that would be recession proof if in fact we did move into some sort of either national recession or global recession. So again, great question, Alice. Really appreciate your thoughtfulness there, and some of the ideas that you are trying to push and really trying to come up with as you're investing. Something that is really near and dear to our heart, obviously, is just the ability to fund these sorts of innovations. Obviously, funding is the lifeblood of innovation, and we need that in order to be able to somehow or another make sure that innovation continues to live and breathe. Along that line, we should let you know as well, we have an Age Tech challenge that we've launched with AARP. Again, go to our HITLAB website, hitlab.org, and look for the AARP challenge. If you have an Age Tech technology and you're interested in applying for different types of support, obviously financial, also different types of research support, etc., mentorship, the AARP Innovation Lab is working in conjunction with us at HITLAB to help do that and to make sure that Age Tech is one of those innovation areas like women's health tech that continues to grow and grow tremendously. It is really an important part of what we're doing. And when you think about the different parts of society who are having the most trouble, where the digital divide is the greatest, you need to look no further than older adults and looking at what they're trying to do with their healthcare, how much and how difficult it can be for them to navigate digital health technologies, and how much we really need to be focused on age tech in digital health and aging populations to ensure that we actually have a better solution for people who are over the ages of 65. So that's a fundamental notion there, and we're really happy to be working with AARP. Love that organization, its mission and its purpose, and what they're doing at the Innovation Labs down in Nashville. And so looking forward to that. And again, stay tuned to our YouTube channel, jump on our email list to make sure that you're informed about when that challenge competition will be held, and to, if you do miss it, to be able to see the videos drop on our YouTube channel, and make sure that happens. Again, remember that subscribing to our YouTube channel is a tremendous way to support the lab without having to spend a dime. Having the ability to communicate with our ecosystem through dropping videos on YouTube is a nice way to make sure that everyone is informed, and that as these pieces of data are coming out, we're either putting them on our blog, we're putting them on our podcasts, or we're putting them on our YouTube channel to make sure that the ecosystem knows about the different data that are being released on a daily basis and can learn about it as fast as possible to avoid any kind of misinformation, any kind of misinvesting, or any kind of misspending that could be happening on digital technologies that don't have the best evidence. And so really critical to do that as well. And I think ultimately what we're seeing is an improvement in digital health technology toward those ends. While we're seeing a divide in some areas of digital health, we're seeing a reduction in that divide. We're seeing more digital health technologies being developed, and being developed for the lowest income 1 billion, not just the wealthiest 1 billion. So we're holding out a lot of hope that that trend will continue. So while the actual the spending is increasing, the divide is narrowing. And so we're getting ready for the 12:30 hour, and we're looking forward to this. We've got a tremendous afternoon lined up for you all, wherever you are in the world, and we're excited to have a number of presentations that are going to focus on this digital health reset, what we talked about yesterday, and we found that there is a substantial reset that has occurred, and we're looking at now a more of a steady cadence of digital health technology adoption, and less of a rapid, quick run. We need it. It's urgent kind of fire drill. And so this kind of new digital health level of purchasing and this new level of activity is just absolutely critical. And starting in about 1 minute, we're going to have what you all love and you all see on every Wednesday from 12:30 to 1, our Women's Health Tech Wednesday, and we're excited to get ready to kick that off as well. And we're obviously every Wednesday from 12:30 to 1, you all know we've got our very own Nina Joshi, who comes in and beams in from Kaiser Health Plans. She's one of the leads with Kaiser on the UX UI side, so she has a great deal of empathy when it comes to design, user experience, etc. And this Women's Health Tech Wednesday is going to be very much just absolutely spot on in terms of addressing some of the major issues that we need to think about, and we need to have open discussions on, which is around these issues of what are we spending digital health dollars on, and are we doing it in the right areas? So with that, I will turn it over to our very own Jerry Antomato to open up the Women's Health Tech Wednesday and carry us into the 1 o'clock hour. Jerry.